The best time to have a facelift is when you look in the mirror and see your aunt in the mirror and say, well, you know, I don't like the way I look tired, I look older, I hate my neck. And it's usually the neck that brings patients in, not liking the shape of their neck because of loose skin and fat and muscles. Most patients arrive in a consultation for a facelift because they notice a change in the shape of their face. And the best way to describe it is that in a youthful face, the face is more of a triangular shape, wide at where the bones are on the cheekbones and narrow at the jawline. And an aging face is like a pyramid, which is wide at the bottom and narrow at the top. And so reversing the pyramid back to a triangle recreates a youthful face. Traditional facelifts are done in one of three ways. One would be just tightening the skin, which is usually not very effective because the skin's already shown its incapacity to maintain shape. The second is just tightening the underlying tissues, called the SMAS plication. The third way is to take a strip of tissue out and tighten the SMAS that way. And what I started doing, and I've done several hundred of these in the past few years, is actually tightening the face from the front part of the face, that is going in the front part of the cheek under the skin. So the incision for the facelift is exactly the same, but the work is done in the front, which allows the corners of the mouth to come up if they've been drooping. It allows the cheek to be raised, it fills in the lower eyelid, and corrects the jawline at the same time. On average, facelifts last 5 to 10 years. It depends on your biology, it depends on sun exposure, it depends on weight gain and weight loss, it depends on how your family aged, it depends on your lifestyle. Obviously, if you gain a lot of weight and lose it, your skin's going to stretch out like it will any place and begin to relax again. A lot of sun exposure is going to cause damage to the elastic fibers and the skin's going to relax. Smoking is going to affect the skin, it's going to turn gray and be older looking. So there are a lot of factors, but if all things being equal, doing the right thing, staying out of the sun, avoiding excessive weight gain or loss, avoiding smoking, a good 5 to 10 years is about average. Interestingly, facelifts are not very painful because in order to move the tissues, the surgeon has to divide the nerves and blood vessels to the skin, and so typically when that's done, the skin is numb. There's some discomfort around the incision line, but again, it's more discomfort, it's not painful. Typically, patients that have lost volume as they get older will have fat injected into the deep compartments of the cheek, jawline, the area of the temporal hollow, sometimes below the eyebrow and so forth, to give them back the fullness that they had when they were younger. A mini facelift, which is frequently advertised, gives a mini result for a mini period of time. A mini lift is not going to give the same result as a full facelift. Obviously, the recovery is faster, but if the recovery is faster, it doesn't mean you're going to be happy 6 months later. These simple procedures that are advertised where 1 or 2 sutures are used to tighten the face, that may be okay if you're 35 years old, but if you're 60, you need a facelift. It's going to take 2 or 3 hours to do it, and the results will be long-lasting. The social media has actually increased the number of people that ask for a facelift because they can see, whether it's YouTube, whether it's on Facebook, wherever the media is, they can see the results of a lift, and they may not be aware of what can be done. So this is something new for them. Social media also has made these procedures more acceptable. It's no longer, a bad thing to say you've had a facelift. It's actually a badge of honor in some cultures to have had, your nose done, or your eyelids done, or your face done. If you're Middle Eastern, fixing your jawline and neck would be very comforting. You probably don't need your brow done. If you're Asian, you probably don't like having a single eyelid. If you have a looseness of the jawline and neck, either fat, skin, muscle, or a combination, you don't like looking tired, and don't like people telling you look tired. And there's a self-improvement, a feeling of a good feeling, well-being by having things repositioned and having people say to you, both your loved ones and your family as well as at work and colleagues, you look great. Have you been on a vacation? What did you do? And in plastic surgery, especially in facial plastic surgery, the best work we do goes unnoticed. That means you can't say, well, who did that? You look tight, you look pulled, it should be natural, and you look rested, 10 years younger, but not as if you had an operation.